Hello, my name is Annalie, and today I'm going to be going over wound drainage systems, which include the Hemovac, Jackson Pratt, T-tube, and the Penrose drains. So the Jackson Pratt is used to bring fluid outside the body. I've seen it used in like gallbladder. Someone had their gallbladder removed, so they had that drain. So you're going to want to make sure you wash your hands every time you empty it. You're going to want to care for the skin around the site where the tube goes. You are going to want to make sure to empty the drain and remove the stopper at the end and pour out the drainage. So you may have to measure that also, and there's sometimes like a little measure right on the bulb, and then you can squeeze, and then you're going to want to make sure the biggest thing is to squeeze it with that stopper not in place, and then put the stopper in place while you're still squeezing it to maintain that suction. I did read sometimes like it could just be air in there and you just want to do that same thing. It's care for the tube. If there is a clot in it, the doctor may tell you to squeeze the tube over the clot. You can also squeeze the tube from your skin to the bulb and then let it go, which should open the tube. Ask your doctor to show you how to, you would want to educate the patient how they do that when they go home. And you're going to want to measure the amount of fluid and write them down. Also educate the patient when they get home that they're going to want to write this down. You're going to be, as the nurse, you're going to be monitoring for signs of infection, like fever, chills, if you get real red and sore around the site, or if the fluid looks abnormal, like if it has a really bad smell, or if it's cloudy, you're going to want to make sure that the doctor's notified about that. You're going to want to sleep on the side, educate the patient to sleep on the side to the opposite of the JP drain, so that there's no kinking and you can maintain that suction. You don't want to bump the drain. Your doctor may also, the doctor may also want them to hold the drain up if they're moving around. So you also want to educate on bathing, how they should bathe and how their activity level should be with the drain in place. The Penrose drain is an open drain system, usually used in wounds. It empties into the absorptive dressing material. It promotes draining passively. The drainage is moving from the area of greater pressure in the wound or surgical site to less pressure. A sterile large pin is often attached to the top of it. That prevents the drain from slipping back into the wound. The drain acts kind of like a straw to pull the fluids out. So you, as the nurse, you'll need to, of course, wash your hands. You'll want to feel around the skin where the drain is inserted, and then you're going to want to wash your hands again and use a washcloth and soap and water to clean around and under the Penrose drain. So a T-tube is something that consists of like a stem and a crosshead. It's placed in the common bile duct, while the stem is connected to a little pouch, so which they call the bile bag. It's used as a temporary drainage post-op of the common bile duct. So with that, you are going to want to make sure the drainage bag is positioned correctly, which helps with the gravity. You're going to want the patient to be in semi-Fowlers. You're going to want to keep that at a low waist level. You're going to want to make sure the tube is tangle and kink free. You're going to want to teach patient to sleep on the other side. Empty it and record the amount per protocol. So right after post-op, they may have blood. In time, a little bit of blood. In time, it's going to turn to that yellowish, greenish brown, like the color of the actual bile, and the drainage amount should decrease. So you never want to have greater than 500 ml of drainage per day. You're going to want to assess the color of the drainage, of course, kind of like the same with the coca. You're going to want to check. You're also going to want to assess the skin and watch for bile peritonitis. In that case, the bladder would be bloated, and you would have nausea, vomiting, diarrhea, and a temperature as possible symptoms. Sometimes you have to flush it if it's blocked, and you're going to want to clamp if it's ordered. Sometimes they will like clamp it for like an hour before or after meals, so that the bile can be delivered to the duodenum. You just it's kind of like seeing how they would react without the drain. You're going to want to assess how the patient will tolerate it when it's clamped, if they have any issues, and if they do have any issues, you're going to want to unclamp and notify the physician right away. So the Hemovac drain, this is a fine tube with many holes, which is attached to an evacuated glass bottle providing suction. It is used to drain blood under the skin. So with that, you're going to want to wash your hands with soap and water. You're going to want to remove the plug from the top of the drain, pour the fluid into a measuring cup, and clean the plug with an alcohol swab or a cotton ball dipped in rubbing alcohol, and squeeze the drain flat and plug it back in. All right.